It doesn't really work, right? And in fact, I pulled this picture off the internet, and I know that that is a model of 5 pounds of fat. And that is a model of 5 pounds of muscle. And the little ones are a pound. So the difference is, and I think it's more dramatic in the 1 pound example, but a pound of fat takes up a lot less, or a pound of muscle takes up a lot less room than that pound of fat. What's going to look better in your jeans?
Ruffles?
Yeah. So, the other thing about fat is we have 27 billion fat cells in our body, on average. Now, fat cells, you add them to your body at 3 points in your life. One of the points is when you're still with your mom, and when you're a baby, and then when you're in puberty. That's when you're adding fat cells. The rest of your life, your fat cell number is not increasing. They're just expanding in size. Or shrinking. They can expand or shrink. You cannot gain or lose. The only way you can lose fat cells is by having them sucked out. Okay. So, muscle and fat are not interchangeable. Fat does not change to muscle. Muscle does not change back into fat. They're two separate things. But muscle can do some good stuff. We gotta love the muscle. A pound of muscle burns 35 to 50 calories a day. That's awesome. That's increasing your metabolism. The more muscle you have, the more calories you're gonna burn every day. But on average, by the time women are 40, they can lose up to half a pound of muscle a year. That's a jip. That's a jip, and it's because, not because all of a sudden the calendar says you're 40, it's likely just because of some of those lifestyle changes. So you got to do what you can to stop yourself from losing that half a pound of muscle. Because losing that half a pound of muscle could in theory mean that you gain 3 pounds of fat a year. So you got to do everything you can to keep that little half a pound of muscle. Okay? Because over time that adds up. 26 pounds, 52 pounds, 78 pounds. All right, just from losing a little half a pound of muscle. All right, so everything that you can do to keep that muscle on your body is going to help. And then I've got this picture. So it shows you. This is a 25-year-old cross-section of muscle. And you can see it's real dark. There's not a lot of fat in there. There's not a lot of fat around the outside. But if you don't take care of your muscle, do what you can to keep that, you're going to start to get more of this marble, more fat in the muscle, and more fat between the muscle and your skin. Okay. Again, this isn't happening just because you aged. There's other things going on there, and you have control of that. So, losing muscle is not automatic with age. You have some stake in that by fueling your body, making sure you're eating enough lean protein. Resistance training. Weight training is not an option, ladies. It's not. If you're not weight training, you're going to end up with less muscle and more fat. You've got to do what you can to keep that muscle. The older you get, the harder it is to keep that, but you have control of that. Weight training is not an option. If we look back at what our ancestors did, what women used to do when they had to do their laundry with the washboard. Now we've got washers and dryers where you don't even have to move it from the washer to the dryer. So we traded convenience for having to go to the gym, having to do some sort of resistance training. So it's our responsibility to do that. Our life is so much easier. We don't have to walk everywhere. We can drive places. But in exchange, we have to take care of our body, specifically our muscle. So weights, resistance training. Oh my gosh, okay, Lori, I get it. I have to do this, but I don't know what to do. For most women, I recommend resistance training 2 to 3 times a week. For most women, doing sets up to 15. By the time you get to 15, it's fatiguing. Not, okay, that's 15. But you get to 12, 13, it's tough, it's heavy. Don't be afraid of it, it's okay. We're not lifting sets of 6. You know, you don't have enough testosterone to get big. You got to do everything you can to save that half a pound of muscle. 2 to 3 times a week. Takes 30 to 45 minutes. Don't be afraid of the weights. For most women, for most of the year, I recommend full body circuit training, meaning you're going to hit every single muscle group every time you work out. You know, you may see other workouts or talk to other people. Oh, well, you know, on Monday I do chest. There's nothing wrong with that. This is just general recommendations for most women for most times of the year. Okay. So that's kind of a little example of circuit training. You don't stop. You keep moving, one muscle group to the other. All right? And typically I usually put 3 things together. All right? There's lots of ways that I can put stuff together. I mean, that's what I studied in college. So that's a whole nother thing. But that's just a little example. All right? Get that heart pumping, get that blood moving, burn a ton of calories. So, let's talk about these diets that we do. Are they making you fat? So I love this study. I think this is so interesting. They took college runners and college gymnasts, female runners and gymnasts, and measured body fat percentage. Very common. We do that with a lot of college athletes. But they also looked at how many calories each of these athletes was eating on a daily basis. Those girls that had the highest body fat percentage were the ones eating the least amount of calories. What's going on with that? Well, what happens is when you're eating less than your RMR, remember that? You're comatose, what we need to feed you if you're in the hospital, sets off, if you're eating less than that, it sets off a survival mechanism which can result in lowering your metabolism, your metabolic rate, by 15%. That's huge. That's huge. So, you're starving, metabolism's slowing down, your body says, okay, I need some fuel to keep this heart beating, the brain thinking, I'm going to go get it from this muscle. Which we're trying to work so hard to keep that muscle. All right, so now we're starting to lose the muscle. Then your thyroid, oh, what a smart guy he is. You'll love this. He tells your body, you know what? I'm not good. I need to store more fat. I need to send the message out to the body to make more enzymes so I can store more fat, because she's not feeding me very much, so when she does, I gotta store that for a rainy day. And you know what? Those enzymes that we need to burn fat, just stop making those, because we're not gonna burn fat just wastefully like that. And you're doing this diet, chances are you're not eating enough calories. There's no way you're getting enough nutrition. So now your organs are not happy either. All this sets you off this whole spiral. It's a mess. It's a mess. So how do we avoid this? How do we make sure we're not doing this? You need to know how many calories you require. And that's where finding out what your metabolic rate or your resting metabolic rate is. Okay? We need to know that number. There's lots of different options. The best calculations actually use your lean body mass. Now you don't know your lean body mass unless myself has, or somebody else has measured it for you. Okay? But let's take a look at some of these equations. I've got 3 of them that I want to go through with you because they're pretty common. If you Google something like this on the internet, you'll find these equations. So the first one, take your weight in pounds and multiply it by your activity level. Now notice, doesn't account for how much lean muscle mass you have. Doesn't even account for the fact that you're a woman. Okay, but it's simple. Simple, nice and easy. I found it on the internet. I'm going to try it. Okay, let's see. So I'm going to take my weight, 148 times activity level. I chose very active. I work out maybe six days a week, maybe a total of 7 hours a week. That's very active, I think. But that's not very active compared to a college athlete. That's not very active compared to the guy who's doing the Tour de France. So maybe I'm only active. I don't know. I just chose it. So there's no way. It's very subjective. Okay. So we calculate that out, and it says that my RMR is 2,220. Okay. We'll just remember that. Then we've got another